Hello, my name is Ashley Griffin. I'm a registered nurse and a family nurse practitioner student at Auburn University, and today I'll be demonstrating a head-to-toe assessment on my patient Chris. Now, normally in the clinical setting, my patient would be dressed in a gown, so I could have direct visualization of the skin for the different areas of the body that I'm assessing. But for this video, he will remain clothed. Also in this video, I may not always do the bilateral exam, but I will verbalize when I'm only assessing one side of the body. So I have already washed my hands and I have reviewed the patient's vital signs, height, and weight. And the first thing you want to do is take a general survey of the patient, and you just want to note their hygiene, their mood, how they converse with you during the exam. And then you can start by inspecting the scalp, and then you want to palpate. And during this whole exam, you're continuously going to be inspecting the skin for any rashes, any dry areas, any bruising, any swelling anywhere. So you're continuously looking at the skin and assessing it. So you want to palpate, and you're feeling the hair texture, the distribution of the hair, making sure there's not any nodules or tender areas anywhere. And then you can assess the frontal sinuses for any tenderness and the maxillary sinuses for any tenderness. Now I'm going to assess your TMJ. Open your mouth and close it and clench your jaws. Okay, now move your jaw side to side. Okay, and that checks cranial nerve number 5. Now for cranial nerve number 7, you want to observe the face while it's moving. So I'm going to have you raise your eyebrows. Okay, now smile with your teeth. Puff your cheeks out. Frown. Okay, now I want you to close your eyes really tight and don't let me open them. Okay, that checks cranial nerve number 7. Now moving down to the eyes, you want to inspect the eyebrows, the eyelashes. His conjunctiva is pink and moist. His sclera is clear, is white. Note the size of the pupils, the iris, and there are several cranial nerves involved with the eyes. For cranial nerve number 2, you can check visual acuity with the Snellen eye chart. You would position the patient 20 feet away from the chart and have them read down to the smallest line that they can complete without getting any wrong. And the number beside that line would be their visual acuity. You can do the same exam from 14 inches away with a smaller chart. I just don't have either chart with me. We can also check cranial nerves 3, 4, and 6. I want you to keep your head still and follow my pen with your eyes. And this is checking extraocular movement, the 6 cardinal gazes for cranial nerves 3, 4, and 6. And then to check cranial nerve 3, you want to make sure that the eyes look medially as the pen gets closer to the face. Also, we can do the cover-uncover test. I want you to just pick a spot over my shoulder and keep looking at it. And you would do this on both sides just to make sure that the eye that is uncovered is not moving when you cover and uncover the other eye. Also for cranial nerve number 2, we can do the confrontation test with the finger wiggle. So cover this eye for me, and I'm going to cover this eye. And I want you to tell me when you see my fingers and how many fingers you see.
4, 2, 3.
Okay. All right. Now we'll do your eye exam. We want to check your pupils to make sure that they constrict. And there is direct and consensual constriction of the pupils. We can also check the corneal light reflex. Just look over my shoulder. Okay. Starting at 0, I'm going to first check for the red light reflex, which is present. And then I'm going to further assess the eye. I'm going to look at the lens and the retina and follow the blood vessels. They should lead you to the optic disc, and the vessels should get wider as they approach the optic disc. And the optic disc is a yellowish, orangish disc that I can see in the eye. Okay, now we will move to your ears. We want to check cranial nerve number 8 with the whisper test, the Rhine test, and the Weber test. First, we'll do the whisper test. I'm going to occlude the opposite ear, and you will do this test bilaterally. I want you to repeat what I say.
A, Z, C.
Okay, and you would do that on the other side as well. Now with the Weber test, it's checking for lateralization. I'm going to strike this tuning fork and put it on your head. I want you to tell me if you hear it equally or if it's more in the right or more in the left.
Equally.
Equally, okay. And that's the Weber test for lateralization. For the Rhine test, you're checking bone conduction and air conduction. I'm going to strike the tuning fork again and put it on the bone behind your ear. I want you to tell me when you no longer hear it. And then I'm going to move it beside your ear. And I want you to tell me again when you no longer hear it. Oops.
Now. Now.
Okay. And air conduction should be longer than bone conduction, so that was a normal test. Then we will examine the ears. You want to inspect the outside of the ears. Make sure there's nothing going on with the skin there. Then you'll want to look in the ear canal. Make sure there's no redness. He does have a normal amount of wax present, but it's not occluding my view of the tympanic membrane, and I see the cone of light. It's like a pearly color. Next we can move to the nose. You want to inspect the internal and external NURS. You want to palpate for any deviations. You want to make sure there's not any excessive drainage. The membranes may be pink and moist. And we can also check cranial nerve number 1. First, we want to make sure that both sides are patent. So if you will occlude one side of your nose for me with your finger and take a deep breath in and out. Okay, any problems there?
No.
Okay, we would do the same thing on the other side. Now I'm going to have you close your eyes and occlude one side of your nose. And I want you to tell me what you smell.
Alcohol.
Okay, all right, you can open your eyes now. And that's checking cranial nerve number 1. All right, now we will move down to your mouth. You want to make sure you inspect the lips, any dryness, any rashes around the lips. Then you want to look inside the mouth and make sure you're looking at all aspects of the mouth. Okay, open your mouth for me. All right, everything is pink and moist. You want to check the gingiva and the dentition. All of his teeth are intact. All right, and looking at the palate, can you stick your tongue out and go, Okay, his uvula is midline, so that checks cranial nerve number 9. For cranial nerve number 10, you would use a tongue depressor to check gag reflex. I don't have a tongue depressor. And to check cranial nerve number 12, you'll want to have the patient stick their tongue out and move your tongue up and down and side to side. And that checks cranial nerve number 12. All right, now we'll move down to the neck. You want to start by inspecting the neck. Again, you'll have direct visualization of the skin. And then you want to palpate the neck. Make sure there's no tenderness or any masses anywhere. You can go ahead and check the lymph nodes at this point. You want to check them with your finger pads and check them at the same time bilaterally so you can compare. Got preauricular, postauricular, occipital, tonsillar, submandibular, submental, the cervical lymph nodes, and the supraclavicular lymph nodes. Got the epitrochlear lymph nodes here. You would check bilaterally as well. Now we can do some range of motion with the cervical spine. If you'll touch your chin to your chest. Now look up and extend your head back. Okay. Now touch your ear to your shoulder, other way, and then look over your shoulders. Okay, that's checking the range of motion in his neck. You can also go ahead and check cranial nerve number 11. I want you to shrug your shoulders against my resistance, okay? And then turn your head against my resistance, okay? That checks cranial nerve number 11. I'm gonna make sure his trachea is midline. And then we want to assess the thyroid. You can either have the patient sip on some water or just instruct for them to swallow. But you want to feel for the thyroid. And then have the patient swallow. And you should feel the thyroid isthmus slide under your fingertips. Now we'll go ahead and do the posterior thorax exam. You would want to inspect the skin first of all. And then you want to palpate, make sure there's no areas of tenderness or any knots anywhere that you can feel. You want to make sure that you're assessing their respirations. You can check the AP ratio. You can check for symmetry. You put your hands at the 10th rib and have the patient take a deep breath in and out. All right, and you're just checking for symmetrical lung expansion. You can check tactile fremitus. Each time I move my hands down your back, I need you to say 99.
99, 99, 99, 99.
Okay, and you'll compare that side to side. Then you'll want to percuss. Healthy lung is going to be resonance, and then when you get to the diaphragm, it may turn, or it will turn dull. All right. And then at the 12th rib, you want to make sure that they're not having any CVA tenderness as well. Then you'll want to auscultate the lungs. You want to make sure that your stethoscope is directly on the skin and that you move in a systematic fashion like a ladder moving down the back. You want to listen for a full inspiration and expiration. Okay, and you're wanting to make sure that the breath sounds are equal and clear. His are normal. There's no diminished breath sounds and no adventitious breath sounds either. So now we'll move to the anterior chest, and again we'll start off by inspecting the skin first of all, and then you want to palpate, check the ribs, make sure there's no tenderness. No pain, no knots anywhere. You can repeat tactile fremitus on the anterior chest as well. Go ahead and percuss. does. And again, healthy lung is resonance, but when you get to like the heart area or over the liver, it will be dull. And again, the stethoscope would normally be in direct contact with the skin so you can listen clearly for those breath sounds. You can go ahead and palpate for PMI. Lean forward. Okay. And you can go ahead and listen to your heart. You want to listen with the diaphragm and the bell at every cardiac point. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And we'll listen to that again. Well, you would listen with your bell, and we'll listen to that again when he's laying down as well. Especially in the assessment of a female, it's important to examine the breast and talk to them about self-breast exam. So you would want to inspect all areas of the breast tissue, including the nipple, the areola, the area around the areola. Of course, you would want to palpate for any lumps or masses, and you would also want to go up to the telespinous and palpate the axilla for any lymph nodes, and you can do this with passive range of motion with the arm. And you would want to examine the woman sitting up and either leaning forward or in a recumbent position as well. You want to examine the breast in 2 different positions. So I'm going to go ahead and check your brachial pulse and your radial pulse. Capillary refills. Okay. And I'm going to have you go ahead and lay back. And while he's laying back, I'm looking for any signs of jugular vein distension, which I don't see. Go ahead and listen to his heart again. And this would be another opportunity to do the breast exam. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And then you can go ahead and assess the femoral artery pulse and the inguinal lymph node as well. And then you've got the popliteal pulse, the dorsalis pedis pulse, and the posterior tibial pulse. And all of his pulses, I would grade them as brisk, 2+, which is normal. You can check capillary refill in the toes. Go ahead and do some other exams while you're laying down. This is the Babinski reflex. I'm going to lightly stroke your foot and make sure he does not have a Babinski sign. I want you to pull your feet back and push him against my resistance. Okay? I would grade his leg strength as a 5 out of 5, which is strong. I want you to put your heel up at your knee and run it down your shin. Okay, and that helps to check for coordination. I want you to bend your knee back and your leg up to check your hip flexibility and mobility. Okay? All right. And before we move to the abdomen, I'm going to get you to sit up and do your, I need to check your carotid and your temporal arteries. You want to palpate both sides of the temporal arteries. And then with the carotids, you just want to do one side at a time. And you want to listen with your diaphragm and your bell at both of these areas. I'll get you breathe in and hold your breath. Okay. And do it again. Okay. You're wanting to make sure there aren't any cardiac bruits in those areas. Okay. Go ahead and get you to lay back down again. And when you move to the abdomen exam, you want to make sure that you look and listen first before you start touching. You want to make sure you don't notice any cardiac heaves anywhere. I'm inspecting the skin. I can see that his body hair distribution is even. I'm going to auscultate in all 4 quadrants. And while I'm listening, this is a good time to also be looking at his arms and his legs, assessing any venous patterns, any swelling, hair distribution. All right. Percuss your abdomen. Now to measure the liver margin, you would go to the right midclavicular line and percuss down until the resonance changes to dull, and that would show you the liver margin. Same thing with the spleen on the left side. You can do that as well. And then you can lightly palpate the abdomen, and then with deeper palpation, you can palpate the liver. And you can try to palpate the spleen, and then the left kidney, and the right kidney. There's also an abdominal reflex that you can check by stroking up towards the umbilicus. Okay, and he's got a good abdominal reflex. And you can also listen for any bruits in the femoral area. All right, we did your Babinski. I'm going to let you go ahead and sit back up. All right, so we've done your head, we've done your thorax, your abdomen, your cardio. During the exam, I have been able to assess his mental status, and he is alert and oriented to person, place, time, and situation. For short-term memory, can you tell me what the weather is like outside today?
Sunny.
Okay. And for long-term history, can you tell me about a very memorable event in America that happened in 2001?
I graduated.
In September.
No.
September of 2001, 9/11.
9/11, yes.
Okay, so you remember that event. That checks long-term memory. And, you know, he's been articulating well during the assessment. He responds appropriately. There are some more neurosensory and neuro checks that we need to complete. For stereogenesis, you want to have the patient close their eyes and hold your hand out. I'm going to put an object in your hand, and I want you to identify the object without looking.
Key.
Okay, and they should be able to identify the object within 5 seconds. Now for neurosensory loss, you want to have two different objects, like a soft object and a sharp object, and you'll have the patient close their eyes, and I want you to identify if I have the sharp or the soft object and where it is.
Left foot, soft. Right leg, sharp. Left arm, soft. Right hand, sharp.
Okay, and you can do this to the trunk and the extremities, just alternating the different objects that you use. All right, now we're going to check some more of your reflexes. It's your brachial radial. Okay. If you can scoot back so your leg is relaxed. Okay, that's the popliteal, the Achilles, or the patellar, excuse me. All right, and the Achilles reflex. All right, now I'm gonna have you extend and bend your elbows, okay, and your wrist, your fingers. Can you spread your fingers out? Okay, now can you put one shoulder out, put it across and behind your back? Okay, and then can you raise your arms up and back down? Okay, stand up for me. I'm gonna have you bend forward. I'm gonna check your spine, check for any signs of scoliosis. Okay, all right. Now can you bend your knee? Okay, and then if it's easier, you can sit back down and show me your ankle, how it can move, and your toes. Okay, so just checking range of motion and all the extremities. I want to check some more aspects of your cerebellar function for coordination. If you'll put your palms on your legs and then flip them back and forth and do it quickly. Okay, that checks coordination. Also, I want you to point your finger to my finger and keep going back and forth to your nose. Just keep doing it repeatedly. And then I'm going to start moving my finger. Okay, and that checks for coordination as well. Now I'm going to have you stand up and come over here. And I just want you to walk, come back this way, and just walk with a normal gait. Okay, now come back heel to toe. Okay, and now turn around and hop. Okay, and then for the Romberg test, I want you to stand with your feet together and close your eyes. I'm just making sure that you're not swaying excessively. Okay? All right, you can sit back down. All right, and that completes this head to toe examination. Thank you so much.